Hello everyone, my name is Mayuresh. I am a social worker at Satya Special School. Today we are going to look at the preventative methods of disability. There are preventions at three levels. Then we are going to look at the general preventative measures. Then we are going to look at care during pregnancy and care at the time of birth, and finally early childhood care. For prevention methods, there are three levels: primary prevention, secondary prevention, and tertiary prevention. Primary preventions include actions taken prior to the onset of the disease or disability, which will remove the possibility that a disease or disability will even occur. The secondary preventions are actions that halt the progress of the disease or disability at its beginning stage and prevents complications. The specific interventions are early diagnosis and adequate treatment. The tertiary level is measures available to reduce the limit and impairment and disabilities and minimize suffering caused by the existing disability. This phase is also called the rehabilitation, which includes physical, psychosocial, and vocational methods taken to restore the patient back to normal or near normal condition. It is extremely important that women take adequate and effective preventative measures during their pregnancy and immediate postnatal period, and also for the children, especially during the early childhood period, in order to significantly reduce the incidence of impairment and disabilities in them. Now we are going to look at the general preventative measures. These include marriage between very close blood relatives like uncle, niece, cousins, first cousins. They should be avoided to prevent hereditary disorders. Then we should avoid pregnancies before the age of 18 and after the age of 35. Before planning a pregnancy, we should consult a doctor. If there is incidence of birth defects in the family, if there are difficulty conceiving like miscarriages or stillbirths, or delivery by operation like cesarean, or obstructed labor like prolonged labor, or severe bleeding, or if you have a negative blood type, or if you have diabetes. Okay, now we have to look at care at the time of birth. One should avoid physical work, hard physical work, such as carrying heavy loads, especially in fields, and other accidents where accidents are prone to happen, such as walking on slippery ground or climbing on stools and chairs. We should also avoid drugs and medications. Even drugs that are normally safe, they can be they can cause serious defects in the health of the unborn child. We should avoid smoking tobacco or consuming alcohol and other narcotics. We should avoid exposure to X-rays and other types of radiation. We should avoid the use of kajal or eyeliners. We should eat a well-balanced diet supplemented with green vegetables, proteins, and vitamins. Our diet should include cooked meal ingredients as well as raw ingredients like salads. All women of childbearing age must take 0.5 milligrams of folic acid every day. It should be taken at least 3 months during the third trimester, when the risk of developing iron deficiency or anemia is greatest. We should ensure that the weight gain is at least 10 kilograms, and we should have regular medical checkups. All pregnant women should be given tetanus vaccine injection. Women who are at high risk, like less than 38 kilograms, or their height is lower than 152 centimeters, or they have anemia, or they have frequent pregnancies, or they have history of miscarriages or abortion, they must get expert prenatal care to have a normal baby. We must consult a doctor in case of edema, be it persistent headache, fever, difficulty or pain passing urine. Now we're going to look at care during pregnancy. The delivery must be conducted by trained personnel, preferably in hospital where all facilities are available. If a baby does not cry immediately, resuscitation should be undertaken at once. Babies born prematurely with a low birth weight need intensive neonatal care. If the baby's head appears to be abnormally small or large, then a physician should be consulted, preferably a pediatrician. The head size must be between 35 centimeters for male and 34.5 centimeters for female. To protect the child from infections, breastfeeding must be started immediately after birth. The first milk, the colostrum, must not be thrown away. It should be fed to the baby. They contain antibodies which are protective for the baby. Now look at early childhood care. Child's temperature must not rise more than 101 degrees Fahrenheit. For any reason, it can cause seizures. If a child gets fits, they should be taken to the doctor immediately. Every child should be immunized against infectious disease as per the recommended schedule of the immunization. Children must not be in contact with newsprint and lead as they are toxic. Precautions must be taken against head injury and other accidents. The child should get a well-balanced diet and clean drinking water. You should introduce additional foods of good quality and in sufficient quantity when the child is between 4 to 6 months of age. To protect the child from meningitis and encephalitis, you should avoid going to places which are overcrowded. You should not slap a child over the face or on the ear. This can cause hearing loss. The child should not use hairpins or matchsticks and pencils to remove wax from the ears. Alright, let's revise. What tablets should pregnant women take and how much of it? They should take folic acid tablets, 0.5 milligrams every day during the first month of the third trimester. Who should get expert prenatal care? Women who are at high risk, such as lower than 38 kilograms or their height is less than 152 centimeters, or if they have frequent miscarriages or they have history of pregnancies or premature deliveries. All these people should get a doctor's opinion before getting pregnant. What should you do if your child gets seizures? You should take him to the doctor immediately. What should pregnant women eat? They should eat a well-balanced and nourishing diet supplemented by green and leafy vegetables, proteins and vitamins.